Good evening all. This is our fourth webinar. The topic is breathing and facial dysfunctions taken by Dr. Selvin James. He is having 13 years of experience in our field. Earlier he was working in Vellore CMC. Presently he is working in Apollo Hospital, Chennai. And this is over to Dr. Selvin now.
Hello everyone, good evening. Thank you, Dr. Chandra Mohan, for this nice opportunity. We have a very special day today. It's because we are going to talk something unusual about our own systems. And hope you can all see the screen which is being shared there. The topic which we have chosen is importance of breathing and facial dysfunctions. This is two different topics over here. One is about breathing and the importance of it. The next one is the facial dysfunctions. So we'll go one by one. How many of us think that breathing is so important? Yes, breathing is so important for every one of us. If we don't breathe, we are not going to live. Then we are no more called as human beings. Then we will be called as dead bodies. Why is this topic chosen today? It's because most of our clients, and sadly sometimes most of our therapists also, have a wrong breathing pattern, or otherwise, to put it in a very simple word, a breathing dysfunction, an abnormal breathing. Why does it happen? It is all because of facial connections. Whenever there is a facial connection problem, or to put it in other words, a facial dysfunction, then there would be an abnormal breathing pattern or a breathing dysfunction. This is why we have chosen this one. And breathing not only disturbs your respiratory system. Most of us think that, okay, breathing is only going to disturb your respiratory system or hardly your cardiovascular system. That's one part of the story. The other part of the story is whenever there's a problem with your respiratory muscles or your breathing dysfunction happens, you can acquire always a back pain. You can have an abnormal spine stability. You can have a neck pain. You can have some other muscle dysfunctions. And that's what we're going to see today. Okay. This picture I've chosen because this picture shows us most of us in our physiotherapy practice, we want everything to happen very easily, just like how Mowgli gets his banana. We expect something magical to happen or somebody to give the magic or somebody to create the magic where we can get the name or we can cure it. This is what most of us expect. But this cannot happen every time. Whenever we have a patient having a neck pain or a back pain or some other abnormalities, some other dysfunctions, some other degenerations, we think about only that particular joint. For example, if we have a patient having a neck pain, we think about only the neck. But if we have a back pain patient, we think about only the back. We do not consider, or we do not even think about the other organs, other musculoskeletal system, the soft tissues, other joints, and especially the facial connection. And we want everything easily to happen. We want results to happen in one single day, which will not be possible. And that's not the proper way also. What is so special about breathing? When we breathe more slowly, gently, and deeply, it helps to calm and relax and also can reduce the tension and anxiety. We know about this statement. And that's why long ago, so many years, we have been practicing pranayama, the yoga. Shallow or fast breathing can contribute to anxiety, muscular tension, panic, headache, etc., fatigue, everything. This, I don't know how many of us have come across this. This is true. When we experience it, when we as a physiotherapist, when we as a specialist doctor experience this, this is absolutely true. You connect. This class is all about, we just have to connect everything with breathing. because breathing is not only just your respiratory muscles or your diaphragm. It is connected with every single part of our body, every single muscle in our system. So breathing is so important, and that's why we have chosen this today. By practicing slow deep breathing, your mind will calm down and your body will relax. This is a proved truth. This is a very proved truth. Diaphragmatic or abdominal breathing is one of the easiest ways to produce relaxation, and that's why whenever you go to a fitness center, or you go meet some yoga specialist or yoga trainer, or a very good physiotherapist, or a very experienced fitness trainer, they tell you to do this breathing, a deep breathing exercise. Whenever you do a deep breathing, your diaphragm is extremely working, and whenever your diaphragm is extremely working, your entire body is relaxed. That's the secret behind it. So what is this respiration and breathing? We would have heard this all through our college days, even sometimes in our school days. We would have come across these two terms, respiration and breathing. How many of you think it's quite similar, or how many of you think it has got difference? Respiration and breathing. Those who think both are same, it's not true. Respiration is different and breathing is different. That's what it says. Respiration takes place in cells and breathing takes place in the lungs. Very interestingly, most of us, I don't know whether we would remember this or we would have even understood this. Respiration took place when we were inside the mother's womb. When the fetus is inside the uterus, respiration starts. But when does breathing start? Breathing starts only when we were born, when we enter the world. So there's a lot of difference between respiration and breathing. Respiration is the elder one. Respiration is the senior one, because it starts when life starts. When a cell is being produced, when an egg is fertilized in the mother's womb inside the uterus, that's the place where the respiration starts. But breathing happens only when we are born. And that's why breathing is the first motor activity of a human being. When we come out from the mother's womb and we start crying, when we make the noise, that's the first motor activity, and so called the breathing. So all of us know a diaphragm. Diaphragm is otherwise called the chief inspiratory muscle. There are a lot of inspiratory muscles. There are a lot of muscles which helps for inspiration, and few muscles that help for expiration. But there's a very specific, unique name for diaphragm alone. Forget about the shape, forget about this origin, insertion, everything. And this has got some specialities also, and that's why it's called chief inspiratory muscles, though there are a lot of muscles which is going to help you for inspiration. The diaphragm extends from, I'm not going to talk about the anatomy and all, I'm just going to talk about few things about diaphragm here. Diaphragm, everybody should have seen, or you can just go look into the diaphragm picture, or there's a beautiful app called Essential Anatomy for Organizations. You just go look into that app and you can see the diaphragm muscle incision. And I'm going to just talk about few fiber insertions about a diaphragm and the specialities about. The diaphragm muscle extends from the trigeminal system of the pelvic floor, passing through the thoracic diaphragm to the floor of the mouth. So that's where the insertion is. The diaphragm muscle has more than one function. Please take a note of that, and has links throughout the body. This is why I have put this slide. Diaphragm is not only the chief inspiratory muscle, it has got lot of functions. It has got more than one function throughout the body and provides a network necessary for breathing. It provides a network. A network is not just one function, it's a group of functions. It's a teamwork. To assess and treat this muscle effectively, it is necessary to be aware of its anatomy, facial, and neurological complexity in the control of breathing. So whenever you have a back pain patient, whenever you have a neck pain patient, whenever you have a patient with a shoulder abnormality, say suppose he has got a stiff shoulder, or whatever you call it, a periarthritis or capsulitis, whatever you have it, or if he has some scapular dyskinesia, if he has some pain in his spine, an abnormal spine, anything, which means your diaphragm is indirectly connected with that pain. I'll show you how in the later slides. And this is why this sentence says, to assess and treat this muscle effectively, we will have to know its anatomy, facial connections and neurological complexity to in order to treat it effectively for the control of breathing. How is it attached? There's a lot of attachments. At the end of this slide, I'll be giving you a link for the article also. It's a beautiful article which tells about the diaphragm and its breathing system. And I've chosen few sentences from that article and also from few other books. Here we're going to say about the attachments. The costal or the lateral attachment section originates into the internal surface of the superior margin of the last 6 inferior ribs via 6 digitations that insert those of the transverse abdominis muscle. Take a note of few things here. The lateral attachment of the diaphragm gets attached with the last 6 ribs, and also it is attached to the transverse abdominis muscle. This is where your facial connection is also. The tendons are shaped as tendinous arc in front of the T12. Take a note of that also. Where is T12? That is somewhere posteriorly, and the tendons get attached to your T12 also, and anteriorly to the transverse abdominal muscles also. Just imagine this. It's a dome-shaped muscle. Anteriorly, it is attached to your transverse abdominis muscle, and posteriorly to the T12, arc of the T12. And lateral pillars insert here, split into 2 robust tendons. The lateral, it is split into 2 tendons. One in the medial arcuate ligament above the psoas muscles. Please take a note of that. It is attached above the psoas muscle, bridging the L1 vertebra. Take a note of that. From T12 is the posterior attachment, and here the medial attachment is above the psoas muscle, bridging the L1 vertebra and transverse apophysis, and the other lateral arcuate above the quadratus lumborum. Quadratus lumborum is at the posterior side, which emerges from the spine of your pelvic bone and gets attached to your lumbar vertebrae and your last rib, connecting the transverse process of the L1 and the apex of the 12th rib. Take a note of that. So this is how it is being attached throughout your abdominal cavity. The medial and the lateral arcuate ligaments act as a bridge between the thoracolumbar fascia posteriorly and transversalis fasciae anteriorly. So look at the beautiful attachment of diaphragm. All these days we would have thought that diaphragm is a dome-shaped muscle. That's an chief inspiratory muscles. We would not have known the anatomy so deeply and the biomechanics of the diaphragm. And that is why I have put all these slides, just to understand how the diaphragm is connected with all the fascias throughout its circumference, anterior, posterior, and the lateral and the medial pillars. So here's a beautiful picture which tells about how your diaphragm is attached. And you can see there's the attachment where it is with the quadratus lumborum in 10. The figure number 10, this is the place where it is attached with this tendon of your diaphragm is attached with your quadratus lumborum, and here number 11 is attached with your psoas muscle, above the psoas muscle, and number 13 is your lateral pillar. This is your lateral pillar. You can see this picture if I could share this slide once this class is over. Okay, so how is it connected with fascia? What are the facial connections in the diaphragm, and how is it breathing so important? It is important to consider facial and connective links between the diaphragm and the pelvic floor. Take a note of that. Your diaphragm not only separates your thorax and your abdomen, it is also connecting your pelvic floor and the rest of the body. The abdominal muscles are related to costal, lumbar, and pubic iliac regions of the body. So that's how it is facial connections are. For example, your rectus abdominis, internal external oblique muscles, pyramidalis, cremaster, transverse abdominis, psoas, quadratus lumborum, sacrospinalis, so many muscles are attached to your diaphragm with their facial connections. In the facial links, it is important to consider that the fascia is rich in corpuscles. When you take a fascia and when you read about fascia, I'll be dealing it with in the later slides. Fascia has got very rich in corpuscles. It's got the Golgi, tendons, Pacini and Ruffini corpuscles, which are proprioceptive properties and provide significant peripheral information as well as having a probable nociceptive function. So that's why fascia is very rich in your mechanoreceptors. which are responsible for pain. And 80% of your mechanoreceptors are in your fascia. So any pain which be in your body will be reflected on your fascia. Further, the facial tissue possesses fibers capable of contracting, probably causing spasm, followed by dysfunction and pain. And this is why whenever there is a pain, it will be reflected on your fascia. And we'll have to remember fascia is stretchable. Fascia is not stretchable, but it has got elastic property. I'll be dealing about what fascia is, what is the contents of fascia also. When there is a problem in the diaphragm or in any other structures belonging to this fascia, there'll be a dysfunction. So take a note of that. That's a very important, powerful statement. When the diaphragm is completely connected with your facial connections anteriorly, posteriorly, and medially, and lateral pillars have been connected. When there is a problem with the diaphragm, when there is a facial dysfunction in the diaphragm, there will be a dysfunction in your other systems also, other soft tissues also. Another important facial system is the fascia transversalis, which is firmly connected to the transverse abdominis muscles and deserves our attention. This is why most of the females get a breathing dysfunctions, because they suffer from menses and they have pain, menstrual pain, and they slouch and sit. And because of slouching, your iliopsoas is affected. Because of your iliopsoas connection, your transverse abdominis, transversalis muscle, these are all affected. And because of that, your breathing is also affected. But we never treat the breathing problem. We treat the back pain, we treat the other pains, everything. And we take so-called painkillers, but we do not treat the breathing system or the respiratory system or the diaphragm. That is why we have chosen this topic today. This is a continuation of the endothoracic fascia and is related to pleura, pericardium, and diaphragm. It originates in the deep and median cervical fascia. There's a very interesting thing about fascia here. Your iliopsoas muscle is a very, very, very important muscle as far as concerned with me. That's one of my favorite muscle because it has direct connection with it has got direct facial connection to your diaphragm and your thoracolumbar fascia. And your diaphragm is directly connected with your sternopectoral fascia, and your superior sternopectoral fascia is connected to your C6, C7 vertebra. That is why any cardiac patient will definitely have some or the other cervical problem. And patients with cervical pain, cervical disc prolapse, or whatever you name it in your cervical, will have some or the other breathing disorder or cardiovascular diseases because your fascia is being pulled over there. A fascia from the superior sternal fascia is connected with your C6, C7 vertebra, and that is connected below with the diaphragm and with your iliopsoas muscle, and of course with your thoracolumbar fascia. That's why fascia is very interesting. These fascia are extremely important because they improve performance of the muscles. When you correct a fascia, it will improve your muscle performance. When you don't connect your fascia, or when you don't treat your fascia, when you don't attend your fascia, your muscle is also not going to improve. Indeed, the contractile forces are transmitted to all directions via the connective tissues, improving its tonus, and the same time sending informations and moving all the body regions. So the connections are very, very, very strong, and that's why the force is being transmitted in all directions throughout the body. If handling of these forces are restrained, postural and visceral equilibrium will become dysfunctional. This is why we have most of our postural dysfunctions. Why does posture get dysfunctioned? It's because of your facial connections, because of your diaphragm, because of the facial chain, because of the iliopsoas muscle, your thoracolumbar fascia. These are all interconnected. You cannot disconnect one from another. The diaphragm muscle not only plays a role in respiration, but also has many roles in affecting the health of the body. That's a very, very important statement. It is important for posture, for proper organ function, and for pelvis and floor of the mouth. Very important statement. We think that the diaphragm is only for respiration. But look at this. These are all not my statement. These are all taken from literatures. These are all taken from cardio books, from articles, all proven articles. So it's a very important statement where we'll have to understand that breathing is so important for your posture, for your other organs, and for your pelvis, pelvic disability, pelvic floor dysfunctions, postural dysfunctions, for so many other reasons. It is important for cervical spine and trigeminal system as well as for the thoracic outlet also. Very important statement. I don't know how many of us have realized all this. Your facial connections are so strong in that, and it's all connected with your diaphragm, which is in the middle of your body, and that's why it says it is important for cervical spine also. It is also vital importance of vascular and lymphatic system. Whenever there's a problem with your lymphatic system or your vessels, please treat your fascia. Please treat your fascia or treat your respiratory system, your diaphragm especially. Give them deep breathing exercises. Give them respiratory resistive exercises. Give them crocodile breathing. Crocodile breathing, I don't know how many of you have understood it. It's a very interesting breathing exercise, very simple, very funny exercises. The diaphragm muscle should not be seen as a segment, but as a part of the body system. This is a very interesting article, very useful article, which was published 7 years ago. Anatomic connections of diaphragm, influence of respiration and body system. People, if you have time, just go through this article. It's a very interesting article which tells about various connections, the neurological connection, fascial connection, articulations about diaphragm, and how important it is for respiration. I think we just have 1 more minute, and I'll stop here. With this slide, and the next session will be continued in another 5-10 minutes, I guess. Dr. CM will take care of that. So this slide is, it says you are working with fascia whether you are aware or not. How much better we would do if we touch the fascia consciously. Touch your clients with that awareness and your results will deepen. It's not said by me, it was said by Thomas Mayers. If you touch fascia really, your results are going to be more deepened. This slide tells about we are knowingly or unknowingly working with fascia, but when we start consciously working with fascia, it will give you a lot more result. The results will be more deeper. That's what Thomas Mayers has experienced and told, and even I have experienced it. That's why I've boldly put up this slide. It's very true. People who wanted to deal with fascia and learn about facial links, and if you really work on fascia, it will give you an excellent result. And let's see about a little bit of history of what fascia and where did it come from, how does it originate from. This is how a fascia will look like. If you take a human being, peel out all the bones, skin, all other soft tissue structures, and you just see a fascia, this is how a fascia looks like. And we have 3 systems in our body naturally given by God. One is a neural network, another one is a circulatory network, another one is a fibrous network, which a neural network works in very few seconds, even less than a second. For example, I could give you, suppose you walk in a dark road, or you walk on a road and you stamp on a sharp knife or a sharp needle, or you just run over thorn. How many seconds would you take to take off your foot? In less than a second. That is how your neural network is. Suppose we are sick, we have some infection, and some of the other medical person is going to give us infusion, an antibiotic infusion, and when it's rushed through our veins, it works faster than a tablet. That's how the circulatory network is, but it's not as fast as your neural network. When you take the fascia network or the fibrous network, it takes few days to few years, but that is the most strongest one, and that is why we have compared this to a rocket, aeroplane, and a BMW car. Your rocket is like your neural network. It works in less than a second. That's why we give pain sensation for those who are fainting or who are in a coma. We give coma stimulation. That's why rocket is. That's how neural network is. Your circulatory system is as fast as your aeroplane, and your fascia network is as fast as your BMW car. BMW cars are the fastest on the road, but not as fast as your neural network. And we also have memory systems in the body. We have the temporal or the temporary memory, the neural or the pain memory, the vascular or the emotional memory, the fascia or the long-term belief system. We'll deal about this. Fascia is like, it is otherwise called as the body's rubber band. This is what I was telling you in a few slides ago. Fascia has got elasticity in it. but it cannot be stretched. And that's why it's called the body's rubber band. And this picture tells you like that. This looks like just like a rubber band. It can be pulled, but it will be recoiled. It cannot be stretched, but it has got elastic properties in it. And flame withdrawal is at 180 kilometers per second. When you touch a hot pan or when you touch a fire, the minute you take your finger out is like 180 kilometers per second. So your flame withdrawal is so fast, and your sensory input is also compared with that. Your sensory input is the base for any movement. For example, if you have a stroke patient, you give some sensory inputs for them. If you are doing a taping, which means you're indirectly giving a sensory input for the patient, your flame withdrawal is also compared like that. And you will have to understand 80% of your sensory nerve fibers are in your fascia. I've told you in the previous slide also. And that is why fascia is responsible for your pain mechanism. And 80% of your sensory nerve fibers means most of your mechanoreceptors are in your fascia. Your mechanoreceptors are those responsible for your pain mechanism. Now tell me, who is responsible for the pain? Are the muscles or other structures or your fascia? It is obviously your fascia, because 80% of your sensory nerve fibers are here. And that's why fascia controls the pain sensation. And what are the contents of fascia? Fascia has got collagen, it has got elastin, it's got fluid, it has got ground substance. And that is why we say when there is no lotion, there is no motion. Females in this seminar would be knowing. We use lot of lotions, creams, this, that, everything for us to look blooming. When there is no lotion, we don't look so glooming. We look dull. That is of your fascia also. When your fascia is there, it has got a lot of fluids. It has got a lot of ground substance, elastin, so many things in that. So your fascia moves smoothly, which makes your muscles and other structures also moves freely. Whenever your fascia is into problem, whenever your fascia has gone into a dysfunction, it has gone into a densification. We're just going to see what densification is in the upcoming slides. When it becomes thickened, when it becomes tight, that is where your muscle and your other structures are not moving. That means no motion over there. When there is no lotion, there is no motion. So sensory receptors in fascia are your mechanoreceptors. So what happens when there is a compensation of movement? Imagine a stroke patient. If he cannot walk, a hemiplegic patient, if he does not walk properly, he has a circumduction guide. That's a compensation of movement. This compensation can happen anywhere across your body. When you have a breathing difficulty, you're not using your diaphragmatic breathing. When you inhale, your abdomen should expand. When you have a breathing difficulty, when you have a breathing dysfunction, an abnormal pattern of breathing, your abdomen is not expanding. That is a compensation of movement. Instead of your diaphragm, we use all your accessory muscles. You use your scalenus, you use your shoulders to take a deep breath. This is where a sensory stimulation can change better than a motor stimulation. That is why we use taping, we use IASTM, instrument assisted soft tissue manipulation, we use cupping, we use needling, we use fascia, so many other things we can use. I've just given 3 examples over here. So this is the place where we have to give a sensory stimulation and not a motor stimulation. This is what most of us do. When we have a stroke patient, we keep pulling, we do passive movements for them. Don't do a passive movement. Just give a sensory stimulus there. Your compensation of movement can change. Compensation can be in 2 ways. It can be good, it can be bad. When it's good, it's a supporting function. That is where we use a splint, where we use a taping, other things. When it's bad, it is so-called a dysfunction. Whenever there is a dysfunction, we will have to treat your fascia. So due to this, its character, fascia can play a fundamental role as it's in the onset as in the resolution of a musculoskeletal dysfunction. This is how fascia and pain are related. Can fascia alter the pain threshold? Yes, definitely it can. I have experienced this, and that is what literature also says. Fascia can reduce the pain threshold. How? When you give a mechanical, physical, or emotional stimuli, the stiffness increases. Whenever there's a stiffness, increase in stiffness, your threshold level is decreased, which leads to pain. Whenever there is pain, which means your fascia is altered. There's another beautiful definition for pain. That is my own definition. Pain means physiotherapists are in need. PAIN. Physiotherapists are in need, which means you will have to address your pain, which means you have to address your dysfunction, which means you'll have to touch your fascia, treat the fascia. When you treat the fascia, your breathing difficulty is altered. It has become normal. This is a beautiful picture. It's a very favorite picture of mine, which tells about the thoracolumbar fascia. The place where I put my cursor is your thoracolumbar fascia. These white patches. You can see the connections. That's what this picture says, the spiral continuity connections of fascia. This goes to the opposite shoulder, the contralateral shoulder, comes through the latissimus muscle, the quadratus lumborum, goes through your gluteus muscle and down to your hamstring muscles. Look at the connection, how strong it is. These white patches are white color is your thoracolumbar fascia. I'll tell you why this picture I've put up in a later slide. So there are three treatment methods, and I follow the first one. The three different methods. One is your RCA, your root cause analysis. Next one is your evidence-based medicine, and next one is evidence-informed medicine. What is root cause analysis? If you have a back pain, if you have a neck pain, just do not treat your neck, do not treat your back. You will have to find out the root cause. The root cause can be your breathing. Root cause can be your hamstring tightness. Root cause can be your facial tightness in your calf muscle. I had a patient who had severe neck pain for 7 long years. And after traveling to so many orthopedicians and so many other physiotherapists and having a lot of medications, he came to my clinic a year ago. I treated him 1 year ago. He was a teacher by profession. I assisted him. He had metatarsal fracture, a multiple metatarsal fracture 7.5 years ago. So that is where his fascia was tight, and that did not allow him to move his ankle joint. His ankle joint was stiff because of the fascia. So that extended to the calf muscle, hamstring muscle, glutes, thoracolumbar fascia, which reached his cervical fascia, and he had a severe cervical stiffness, which was not treated by any other orthopedicians or other medicos. So that is where we'll have to find out the root cause. So whenever you have a patient with any other pain, always try to connect it with the facial connection, connect it with the facial chains. Evidence-based medicine is all other things what we do. All your allopathy medicines, your electrotherapy, your exercise therapy, all things. Evidence-informed medicine is we just listen to what our patient says. That is evidence-informed medicine. We listen to our patient, he tells some symptom, and we give some treatment. That is evidence-informed medicine. And that's what the last statement says. Do not treat the pain. Treat the movement pattern always. Look for the movement pattern. And that is why I keep telling all our colleagues the best tool for a physiotherapist to become a good physiotherapist or to become a best physiotherapist is, number 1 is your fingers, your hands. Number 2 is your eyes. Observe your patient. Look for the movement pattern. Always look into the direction where he moves his shoulder, neck, body, everything. Look into for his breathing pattern. Look into the pattern. If there is some abnormality, then find out the root cause, treat the fascia, you will have best results. What is the role of fascia here? Fascia has an important role in nutrition and metabolism. Other functions of fascia include protection, structural integrity, shock absorbance, and hemodynamic processes. This is why fascia is so important. This is why I've put up here. And Pelletti, an article he says describes fascia protective role in preventing injury to anatomical structures contained within it or supported by it from the forces of tension continually experienced by human body. So fascia has got multiple functions. We're just going to look into what are the multiple and varied functions of fascia. Fascia allows for the communication of information throughout the body. That's why I showed you the first picture of the fascia. Fascia does not have any origin. It does not have any incision. It does not have any particular connection. It is just like a bedsheet covered throughout your body. So that's why it can communicate from wherever you want. That's why I gave you the example of my patient who had a cervical pain for 7.5 years, but the problem was his fracture, which was not treated properly. It was just treated with the POP. So he had a stiffness over there. There was no lotion. There was no motion. His ankle was strong. It was fixed. It was fused. And that is how his facial connection went through his neck. Fascia is a sensory organ that moves and reacts to stimulations. Take a note of that. That is why I kept telling, give a sensory input rather than a motor input. Fascia is connected to nutrition and metabolism at the cellular level. That is why we say fascia has got elastin, it has got collagen, it has got ground substance, it has got hyaluronic acid in it. That is why fascia is connected at the cellular level. Fascia is the first and foremost organ which has been created in our human body. When a cell has been formed in the uterus, what do you think has been covering the baby? It is the fascia. Fascia controls the movement, allows the muscles to function. Whenever a muscle is not moving, whenever you have a stiff shoulder, a stiff neck, whenever you have a knee joint stiffness, treat the fascia. There might be a facial tightness. That is why your muscle is not moving. Don't just keep pushing the muscle or pushing the patient to do an abduction of the shoulders or an extension of the knee. Try treating the fascia. Try for the facial links. Try for its breathing pattern also. Fascia plays a major role in circulation of blood and lymph. We have already seen this. Fascia is the first line of defense mechanism in immune functions. It's a very important statement. Most of us do not understand this. Disruptions and restrictions within the fascia are connected to disease and dysfunction. If there is a disruption, if there is a restrictions within the fascia, it will definitely lead to a disease or a dysfunction. Fascia protects every aspect of the physiology from physical and environmental stresses. When you treat your fascia, definitely there are chances where you can decrease your stress also. This is the difference between a fibrosis and a densification. This is how a fascia becomes dense. The deep fascia is a complex structure formed by at least two components, 2 or 3 layers of collagen fibers bundles loose connective tissue. And you can see where this is moving. This is a fibrosis. An alteration in the collagen, collagen tissue will give a facial fibrosis. An alteration of the loose connective tissue will produce a facial densification. So you will have to understand difference between a facial fibrosis and a facial densification. When there is an alteration in the collagen tissue, then it's a facial fibrosis. When there is an alteration in the loose connections of the tissues, that will produce a facial densification. It's very important to differentiate. That is why I told you the best tool for a physiotherapist is your fingers, is the hands. You will have to palpate it. You'll have to palpate, touch the patient. I keep telling all my colleagues, all my friends who all work with me, all my students to touch the patient. We have, of course, we understand that India has got a lot of cultural restrictions where a male cannot treat a female cannot treat a male. But that is entirely wrong, entirely wrong. I tell all my patients, whether it is male, female, irrespective of whatever age may be, madam, sir, I will have to treat your skin, not your dress, not your costume. Please take it off. Drape the patient, whoever the patient may be, whether it is a male patient, female patient, young, old, whoever it is. Drape the other parts. Tell them, give them clear instructions. Take some of their attendants. If they have some cultural restrictions, if they have shyness, take their husband, take their wife, boyfriend, girlfriend, friends, anybody along with the patient, but treat them by touching the patient. Only then you will identify, only then you can palpate and feel it, whether it is a fibrosis or a densification. If you have warmth, if you have any other restrictions, if the pain, if the problem is with the fascia, problem is with the muscle or some other soft tissues, you'll have to touch, palpate, only then you'll know. Please do that. This is how a fascia has been gliding. Whenever there is a dysfunction of the connective tissue will decrease the capacity of gliding. This is what we see. Whenever there is a dysfunction, it means there is no lotion. The elastin, collagen, ground substance, and the hyaluronic acid, everything will be decreased, and there'll be no motion. There'll be no gliding of the fascia. When the fascia does not glide, there'll be no movement in your muscular system. Fibrosis and densification. I just want to give you a few examples of this. Fibrosis is similar to the process of scarring. Everybody would have fell down in some time at your lifespan. We would have had some other scars. You touch and see the scar is more thicker than the densification. Only when you palpate, you will identify this, not by just listening to any lectures. With the deposition of excessive amount of fibrous connective tissue reflecting a reparative or a reactive process, it can obligate the architecture and function of the involved tissue. Whereas densification indicates an increase of density of the fascia. Take a note of that. Fibrosis is different. It's a process of scarring. Densification indicates an increase of the density of the fascia. By this means the mechanical properties of the fascia will be modified. We saw the mechanical properties. Fascia has got collagen, it has got elastin, it has got hyaluronic acid, ground substance, water, fluid, everything. So all these properties will be modified or altered, but without a change of the general structure. That's very important note over there. The general structure will not be altered, but the physiological properties or the mechanical properties will be altered. That is densification. Fibrosis is that like just in your dependence contracture. You can see thickness over there. But in densification, it's like in the chronic non-specific neck pain or a chronic aspecific low backache. Seems to be associated with facial densification. In reality, for majority of the cases, it's not clear whether facial densification or facial fibrosis is involved. This you will understand only when you feel the difference, when you understand the difference between what a fibrosis is and what a densification is. And first of all, to understand a densification, we will have to know what a fascia is, where the fascia is, what are all the contents of fascia, and what is the physiological properties of fascia, and what happens in a densification of the fascia. This is how a link is. This is also one of my very favorite picture which tells about how facial links are connected. You can look into the red color arrow mark where all the facial links are connected. And I just want you to take a look at this place where I'm putting my arrow mark. This is your diaphragm, and look into the facial connections over there. The direction of the connection, and which is in turn connected with your pelvic floors. This is also one of my favorite picture which tells about the thoracolumbar fascia, which has been connected with your transverse abdominis muscle at the anterior part. In the trunk, the apennodic fascia, the thoracolumbar lumbar fascia, and the rectus sheath functions as a flat tendon for the adjoining muscles. The large muscular laminae of the trunk inserts completely into the aponeurotic fascia. In this picture, you can see where the fascial links are. It is connected with your ribs, also connected with your pelvic muscle, pelvic bone at the medial aspect. This tells us the connection, facial connection, where the diaphragm is also connected with the transverse abdominis muscle. These joints need to be evaluated and treated for mobility and function, just like bony joints, as two types of joints work in unison to create global body movements. So these connections are supposed to be taken into consideration. Very often, due to trauma or inflammation, inappropriate loading, these tissues become adhered to one another and lose their capacity to slide. It's a very important statement. Imagine you have an injury, you have an RTA, you have a trauma, or you have an inflammation. You tend to be slouched. When you have a pain or a trauma in your neck, shoulders, or your back, you will not be comfortable in sitting erect. You will be slightly slouched. We will all be slightly slouched. This slouch position alters the or adheres the functional, physiological functional properties of the fascia. That is the place where it alters the mechanism of fascia, and there is an facial densification. This facial joint dysfunction, you just saw the facial connections. These connections tend to become as facial dysfunction and needs to be identified and treated. When we don't identify these joints, your respiration cannot be treated. So whenever there is a dysfunction in your pelvic floor muscles, the hip joint, or your back, spine, chest, shoulder, neck. Think about your breathing. Whenever there's a breathing abnormality, postural dysfunction, think about fascia. Connect your fascia with breathing. Once facial dynamics are restored, it is interesting to observe that bony joint restrictions will often improve or resolve. That's a very important, powerful statement. That's why I put it in bold. Once facial dynamics are restored, it is interesting to observe that bony joint restrictions will often improve or resolve. This is very, very important statement about the iliopsoas connection. This is also one of my favorite muscle, as I told you earlier. Iliopsoas, or the hip flexor, has a vital role in our everyday activity like walking and running. All of us know this. It connects the spine of the lower extremity. We also know this. It functions as a powerful hip flexor and stabilizers of the spine and trunk during their movements. Take a note of that. Powerful hip flexor and stabilizer of the spine. Two functions are here. Take a note of that. So your hip flexor is connected with your facial links, which is directly connected to your diaphragm. It has an important role with breathing. How many of us have noted this or come across this statement? Your iliopsoas has an important role with breathing, as it attaches to the diaphragm and therefore gets affected during emotional and physical stress. This is why most of our Indian females are emotionally very weak, because of the flexors, hip flexors. Whenever we are weak, whenever we are stressed, whenever we are emotionally troubled, when there is a death happening in our home, or whenever we are out of focus, we tend to slouch and sit, or we lie down in a crooked lying position where your hip flexor muscles go into a slightly tensed position, where in turn it affects your breathing. That's why this statement says it has an important role with breathing, because it's directly connected with your facial links to your diaphragm. Psoas muscle is also known as muscle of fear. This is why most of the females, commonly the South Indian females, get affected with menstrual problems. Treat your iliopsoas with a facial connection. Treat your diaphragm muscle. Treat your breathing. Females will recover from this. They will not have any menstrual pain. They will not have any emotional stress. Or anybody, male, female, who are emotionally weak, who are stressful, treat your psoas muscle. Treat your facial connection with your psoas muscle. You will be out of pain, out of stress, and treat the breathing pattern also. They will have breathing dysfunction also. And prolonged stress mean a contracted tight psoas muscle. Those who have prolonged stress have a tight psoas muscle also. You will have to treat this. When these muscles become tight or sensitive, they can cause intensive back, pelvic, hip and leg pain, postural problems, breathing problems, and stress-related aches and pains. Take a note of this statement. Very, very important, whereas directly psoas muscle is connected to your breathing. Whenever there's a problem in this muscle, whenever there's a tightness, it can cause intensive back pain, pelvic pain, hip, leg pain, postural problems, breathing problems, and stress-related aches and pains, which means females are most affected with iliopsoas muscles because due to their personal habits, because of the female hormones and their menstrual issues also. The pain you will usually feel where your gluteus meets your lower back. That is the place where the pain you will feel at the top of your pelvis. But when bad enough, it can refer down as like a sciatica. When the pain worsens, when the pain is there for a long time, say for 1 month, 2 months, it can reflect like a sciatica, but it is not sciatica. It is your iliopsoas dysfunction. Please treat your iliopsoas fascia. Treat your breathing pattern, because iliopsoas muscle is directly connected with your diaphragm. And we have come to the end of this session. And this is very, very powerful statement. I put this slide wherever I go. Symptomatic treatment does not bring you a cure. Only expert treatment of the cause will yield you success. So those who are here connected with us today, if you want to be a best physiotherapist, if you want to be a good physiotherapist, and if you want more success stories, please do not treat symptomatically. Do an expert assessment. Only expert treatment will give you success. That will give you, that will yield you success. If you want to be successful, if you want an expert assessment, do an elaborate, detailed assessment. Deal with breathing. Any patient, if you have with your pain, any pain, menstrual pain, back pain, pelvic pain, neck, shoulder, knee pain, check for the respiratory pattern, because your diaphragm is such a wonderful muscle created by God, which is connected with most of your organs, internal visceral organs, most of the fascia of your body, especially your iliopsoas muscle. Those girls, women, men who are stressed, patients who are stressed too much, who are stressful for a long time of period, who have a chronic back pain, chronic pain syndrome, check your iliopsoas muscle, check for the facial connections, check for the breathing pattern, treat your breathing dysfunction. They will be out of pain. Thank you so much for having connected with us. Thank you, CM sir, for this nice opportunity. Those who have questions can put up. We have another 4.5 minutes.
Yes.
Good evening,
yes,
sir.
We can take
Hi,
5
good evening.
minutes of rest. The session will be going to end in 5 minutes. Okay. We will take a break for 5 minutes. We will reconnect with the new idea.
That's wonderful.
Fine.
That's wonderful to hear from you, sir. Thank you so much. Those we have another 4 minutes. Those who wanted to ask any questions can go ahead. I'll try to answer as much as possible.
Yes.
Good evening, sir.
Good evening.
Sir, how can we differentiate between contracture, adhesion, spasm, and tightness?
Beautiful. See, contracture is very simple to identify. It's going to be only there if the patient is going to be a long bedridden patient, isn't it? If there's a stroke patient, a traumatic brain injury patient, a spinal cord injury patient, then it's going to be a contracture. A facial dysfunction can happen to you, it can happen to me, it can happen to anybody. Even a fellow who's sitting on the system for 8 hours, an IT company person, a teacher, a physiotherapist, a surgeon. I have treated 2-3 cardiac thoracic surgeons in CMC who are operating, say, somewhere around 8 to 10 hours in a day, who does open heart surgery. They're always in a bent position. They can have facial dysfunction. They can have facial densifications. That's simple. A facial densification will not have much of restrictions, but a contracture will have. They will have joint range of motion, reduced joint range of motion.
Okay, sir. Thank you, sir.
Yeah, welcome.
How to assess for facial restrictions by Dhwani Vora?
How to assess facial restrictions? See, this is what I've been telling. You will have to touch. You will have to palpate. I think CM sir remembers that we had a class about palpation some months ago. See, you just have to put a piece of hair inside a paper, fold the paper, close your eyes, and you have to find out where your hair is. So your fingers should be so strong in palpating even a small hair. So that is how you'll have to practice. You'll have to train your fingers. It has to be extremely strong to palpate even small difference in your skin. You have to practice. It will come once you start practicing. It cannot come in one single day. You'll have to start practicing. You'll have to understand how there is a movement between fascia and other soft tissues. Is there any assessment rule of fascia? Yes, there is. Lakshmi Prasanna, one is asked about. Is there any assessment to rule out facial dysfunction from other structures? Yes, ma'am, we do have. We have assessment. We have a very different assessment in facial manipulation. I have done facial manipulation from the Stecco Institute in Italy. So we have a different pattern of assessment. That you will understand only when you study, when you learn facial manipulation. So that what is KCAT? KCAT is slightly different. That is kinetic chain activating technique. That's slightly different. Good reference to study more about fascia. Yeah, there are a lot of articles. Somebody has Roy has asked about references. There are a lot of references, a lot of articles, books, a lot of books in fascia about fascia. Okay, how to treat deep fascia? Fascia manipulation is the best.